So let's say that you've been asked by your doctor to self-quarantine or isolate because of COVID-19. One of the first things you're gonna do when you get home is pick a room in your house that's gonna be your home base. This is where you're gonna spend 90% of your time avoiding other household members and taking care of most of your activities of daily living. So once you've decided on a bedroom, one of the things you're gonna wanna do is make sure that it's close to a bathroom. Ideally, it'll have a bathroom inside it that's it for the room's exclusive use, but if that's not possible, then just close to the family bathroom or a common bathroom, so there's not much walk through a hallway or other common areas. The room is essentially gonna be your home base for the duration of your isolation or quarantine. In the room, you don't have to wear a procedural mask. You can kind of move about the room as you normally would, but you're gonna be doing all of the cleaning and all of the care taken in this room. Ideally, no other household members are gonna come into this room during the duration of your isolation. Your room should ideally have a single point of entry and exit, so it's easy to control who's coming in and out of the room, and it's also easy to seal off the room to other household members. If you'd like to have windows open, that's perfectly appropriate and fine. There's no risk to that, but the moment you leave that door, you need to put on a procedural mask and be much more conscious about what surfaces you're touching and what you need to decontaminate as you go. If you do have to share a bathroom, one of the things that we want you to do is make sure that you're wiping down the surfaces that are commonly touched in the bathroom. It's super important, especially if other family members are going to be using it. Some of the areas that we really want to make sure you get are the surface of the sink and the handle of the faucet. Those are going to be touched often. The handle on the toilet and the handle on the door are both also high touch areas. These are areas where you're likely to have contaminated them with viral particles that could then spread to your family members. So this is one of the high risk areas. Certainly any of the EPA approved sanitizers would work. So wiping them down with a disinfectant cloth or spraying them with disinfectant spray on it and let it air dry, it'll increase the contact time on the surfaces and make sure all of those viral particles are killed. The other things you want to make sure of is that any linens that you leave in the bathroom, if you disrobe here, you're taking them out with you and making sure that you're leaving kind of a pretty clean bathroom for your family members that aren't infected. For laundry, it's really a low-risk activity. The most important thing is to make sure that you're putting your own laundry into the washing machine so that no one's handling your soiled linens. But other than that, you can wash your clothes with family members' clothing. You can wash them separately. It doesn't really matter. You make sure you just use an adequate amount of pods or soap and then dry your clothes on as high a heat as the clothing will tolerate. There really is very low risk to this. If you don't have laundry in your building or in your home, that's fine too. You can take it to a laundromat. That's not a high-risk procedure. Just make sure you're wearing a mask when you go outside. So if you have to be in the kitchen, and you really ideally don't want to be in the kitchen, this is a place where you really want family members or household members, if possible, preparing your food and delivering it to just outside the door you're going to be isolating in. But if that's not possible, you want to be very careful. Wear a procedural mask while you're in the kitchen and make sure that every surface that you touch or use, that you're disinfecting it. You're going to take a disinfectant spray, you're going to spray the entire surface so that it's nice and wet and stays for as long as possible on the surface, and then wipe it down, making sure that you're clearing any particles or other things that could be contaminated. You're also going to want to make sure that after everything that you do that you're washing your hands. Keep in mind that hand washing is the most effective way of cleaning your hands. The hand sanitizer only really disinfects the surface of your hands. If there's any dirt or grime on them, it's not going to clean under it. So soap and water actually wipes away viral particles, wipes away dirt and grime, and is the most effective way to keep our hands clean. So if you receive a package, that's good news. It's actually one of the most lowest risk parts of your isolation. So packages really can't transmit the viruses for very long. They're not likely to stay on the surfaces. Obviously, if you do get a package and it's been recently handled, so a food package that just came in with a plastic bag, you can wipe down the outside of the package just as an extra precaution, but there's really very low risk to this. Anytime I handle anything outside of my home, I'm sanitizing my hands the moment I come back into the house. So this is an area where you either wash your hands and then do whatever else you were going to do, or use hand sanitizer at the door, whatever you happen to have in your house. But it's one of the areas that's considered touching the outside world, so when you come back inside, you're washing.